Hi, everyone. Welcome. Today we are joined by David Emanuel, who is the CEO, co-founder of VectorCare. We're especially excited to dive in with VectorCare today because we hear from many of you, our clients and members, around how the friction in patient flow is a constant barrier, especially as you think about bottlenecks that keep patients in bed longer than necessary, which can impact length of stay, but also the patient outcomes as well. And so, as we get started today, thank you for joining us. My name is Amberly Dietz. I'm one of our vice presidents here at Avia. We're going to dive a little bit deeper into the voices of the network. And before we dive in, I'll have David give a quick introduction. David, could you introduce yourself?
Yeah, hi, I'm David Emanuel, CEO and founder of VectorCare. VectorCare is a patient logistics platform, and we'll dig into some of the details shortly.
Perfect. Thanks, David. So as we talked about VectorCare solving one of the most key problems that we see from a patient transportation perspective, what are some of the core problems you're focusing on right now and why they're important for health systems? You know, we hear from a lot of our members that the last mile bottlenecks, so really thinking about discharge delays that are often more logistical, that aren't clinical, that we have to wait for, before that patient can leave, they may be waiting on something to be discharged. So can you share more about some of the core problems that VectorCare solves for?
Sure. I mean, it's a pretty layered question in terms of all the different problems, whether it's operational, whether it's quality of patient care. They're all connected. They're connected in the sense of not having good systems in place and infrastructure to support patient logistics at scale, right? And when you think about patient logistics, it all starts potentially at discharge, where the patient is about to get discharged and we can't find a transport, right? So, finding that transport as quickly as possible so they can get to the skilled nursing facility before 3 p.m., reduces length of stay. But it's not just discharge, right? It's the post-discharge coordination, making sure the patient gets back to a doctor's appointment. So, reduce readmissions into the ED. It's scheduling that home health visit to help reduce readmissions post-discharge. So the nurse is scheduling the patient to go home, but they're also scheduling that home visit within 24 hours to make sure there's food in the fridge and medication adherence. So it's pretty layered. When you think about healthcare systems in general, though, right, is most of that workflow lives outside the EHR. They're picking up the phone, they're faxing, they're using a tech-enabled service, which really isn't a platform. What we do to solve is bring all of that coordination into the EHR. So, customized workflows that live inside the patient record and gives you full visibility from scheduling to actually what's happening. Did the event actually take place? And real-time updates so you can see on a map, and then messaging directly with the care teams that are delivering care.
That's amazing and definitely a key problem that many of our systems have. So it's great that VectorCare is in the space doing that. Let's dive a little bit deeper into the solution overview. I know you mentioned that it's within the workflow. Can you share more about, how it works from an end-to-end representative workflow? You mentioned a little bit about discharge transportation as well as some of those interfacility transfers. Let us more into how it works.
Yeah, so the platform's designed to make it really easy to build these custom workflows. The saying goes, if you've seen one hospital, you've seen one hospital. If you've seen one EHR, you've seen one EHR. No place or no workflow is the same. There's nuances that you have to account for. We spent a lot of time solving that problem, right? We built this no-code workflow application that allows you to build these custom workflows. The second piece of that is, where do you put that, right? And so we spent a significant amount of time over the last decade finding different avenues for anybody that wants to schedule patient care, whether it's from a mobile device, from a web experience, and now inside their EHR. So we try to make it as easy as possible to build the workflow you want and then put it in the hands of the people that need it most, which is your case managers and nurses and those people that are frontline staff coordinating care for patients. The real underlying issue, and I think this is the problem that we solve the most, is that CIOs and CTOs and healthcare systems in general can't manage more applications outside of the EHR. There's security risk, it's additional admin, it's unnecessary friction. Our goal is to bring everything into the EHR. So it's easy to build and deploy workflows, and give it to the people that need it most, who are working inside the EHR and can do these things seamlessly. And that's the platform capabilities, right? You can use our existing Smart and Fire app, or you can build your own on our platform as well.
David, that's such a great point. And I know I saw a recent publication where you all have just recently published the SOFAS application. Tell us more about that, because I think, especially what we hear from our members, part of the barrier that they have in integrating certain solutions is that integration. And it sounds like this is, completely within the EHR, and the workflow is so seamless. Tell me more about SOFAS.
Yeah, so SOFAS stands for Smart on Fire as a Service, right? This is the key ingredient to helping vendors that provide services to a healthcare system to get inside the EHR. And normally, if they went to market or tried to hire people to build Smart and Fire apps, it could take 12 to 18 months, cost over $500,000 to do that for vendors to be able to do it. And then they've got to do that across 20, 30 different healthcare systems, manage the compliance, and security requirements to be able to do that. We take all of that complexity, and SOPAS allows a vendor to be able to build these custom workflows and work with the hospital to integrate that workflow that they've built on our platform inside the Epic environment, as an example. So from the patient record, if you've got a DME provider that you work with, you can start scheduling oxygen delivery to the patient's house from inside the patient record based on that vendor's Smart and Fire app they've built on VectorCare. Same for transportation. We recently just launched the Lyft Smart and Fire app, which you can see in the Epic showroom. It's a great example of taking a real problem, which was discharge, getting a patient home that needs, a sedan car ride home, but also scheduling that visit back to the hospital, back to a doctor, or getting to an appointment. That's just the example of the capability of Smart and Fire that solves a real problem inside the healthcare system and easily deploy that into the EHR.
Thank you for sharing that. And I think that has been a true differentiator based on what we're hearing from our members as well. Speaking of differentiation, I know you mentioned a lot about some of the vendor neutrality. Can you talk a little bit more about that and how VectorCare truly acts as a platform and doesn't matter what vendor you're using?
Yeah, I mean, we kind of always say that we're Switzerland, right? And if you're building the rails for patient logistics, think about Visa and MasterCard. Doesn't matter what bank you're using, Visa and MasterCard are powering those transactions. It's the same for VectorCare and patient logistics, right? We don't have any favorites in terms of who and what vendors you should be using. We're just the pipes to make sure that that request gets sent to the right vendor, and that information comes back, keeping the nurse and case manager inside the EHR. Who you invite onto the platform and who you configure workflows with. We don't care. What we care most about is, can we do it efficiently and make sure that the patient gets the care they need?
Absolutely. Before we dig into some of the key results and some of the KPIs that you've seen, especially as we think about the differentiation of the platform, who do you see as kind of the target audience that uses the platform? Imagining, part of the challenge is getting the patients out the door. That is a logistical concern. Who uses VectorCare from a health system perspective, or a provider as well?
We're essentially a SaaS-enabled marketplace, and what that means is that we sell to both sides of the marketplace, right? So essentially, hospitals, payers, and providers, they are our top of the marketplace customers. They create the requests, they build out their networks and connections with their vendors, right? But we also help vendors, get into the healthcare system, win contracts, give them the tools to be successful, where they don't have the tech skills that they need to go and build these type of solutions like Smart and Fire. We complement their IT team to be able to go and win contracts and streamline processes. So we sell to both sides of the marketplace. Again, we think about Visa and MasterCard. We really are just the pipes. We want to make sure that care is delivered as quickly as possible with the least amount of friction.
Yeah, absolutely. Thanks for sharing that. So as we think about, results and impact, what have you seen with the folks that you've been working with at VectorCare?
Yeah, I mean, we support more than 2,500 hospitals across the US in some form or fashion, directly or indirectly. All of them have different results. But I would say with the one that's the most consistent, right, when it comes to discharge workflows, reducing length of stays is a key KPI, right? And we're able to make a significant impact on that. The second one is probably reducing readmissions, which everybody is chasing a solution for, right? So being able to schedule the patient's ride home, but also being able to schedule those post-discharge events so the patient doesn't come back into the ED within 30 days, right? And being able to do that in one user experience, right? And the future is autonomous and it's agentic, and we're thinking about what AI is going to be able to do in the world, and reduce the administrative burden, right? We've built the rails to be able to leverage that type of agentic workflows. And one of the key things that we're moving towards, and we already started doing this, is multi-event scheduling, so that you're reducing length of stay and you're reducing readmissions all in one user experience. That means a nurse that goes to schedule transport is not just scheduling the ride home, they're scheduling the ride home, the home health visit within 24 hours, the appointment back to dialysis, and the oxygen delivery all in one user experience, instead of siloed systems that don't talk to each other. That's the future, and be able to just push a button and watch your agent go and do that. It's pretty exciting.
That is amazing. And just think about, that care team members who's making those schedules. What a win for that person pressing the button, because
Exactly.
oftentimes you have to make many calls, fax, do all the referrals. And so what an amazing solution that you all are looking at. And also just from the length of stay and readmissions, we hear a lot from our health systems on how capacity is such a burden. So it's great to hear that you're seeing results in reduced length of stay as well as readmissions. As we think towards the future here, and you mentioned a little bit of this from an innovation standpoint with agentic AI and some of the other, as we talked about the SOFAS, what do you think about as you look towards the future of healthcare and what VectorCare is doing? Anything that we should be looking out for?
Yeah, I mean, SOFAS or Smart and Fire as a Service is a key infrastructure layer to the future of agentic workflows, right? This is just the first step in terms of truly leveraging what's to come from an AI perspective. I think when you simplify implementation of workflows into the EHR, and you just think of the EHR as just a database, right? And you can build really intuitive tools that live inside the EHR, and then put strong policies on what the agent can do and can't do. All of a sudden, the case manager and the nurse who spent years studying get back to delivering care and not having to do admin.
Yeah, that is amazing. And I think, based on a lot of the work that we've done with our members, giving the nurse or the provider time back in their day is
Yeah.
definitely key, but also from the patient perspective, the outcomes, because they're able to go home and not be readmitted to the hospital. That is amazing. David, thank you so much for your time today. This has been a fascinating look at what VectorCare is doing, and we're definitely excited to see what you all will do as you remove friction from patient logistics. For more information about what VectorCare is doing for the viewers, definitely feel free to look at their website, but also on our Avia marketplace as well. Thank you for watching, and look forward to hearing more about VectorCare. Thank you, David.
Thank you.